Thank you for choosing Floyd Medical Center. As part of our goal to provide care that goes well beyond expectations, we have created this video to guide you through the surgical process. We understand that with any medical procedure comes a certain level of anxiety, so we provide as much information as possible prior to your surgery. You can take comfort in knowing that Floyd is a quality and customer service leader with unmatched medical expertise, and we're among the top Georgia hospitals in the prevention of surgical infection. Your surgery will take place in a modern surgical suite equipped with operating room of the future technology, including high-definition imaging. These medical advances allow physicians to perform surgery that is minimally invasive with maximum benefit. After surgery, you will be cared for in deluxe rooms designed with your comfort in mind. Our team of professionals is available to answer any questions and to provide care and support for you and your family through your surgery and recovery. Your comfort is one of our top priorities. That's why we work so hard prior to the day of admission to prepare you for what's to come. Let's take a look at this process. In addition to the preoperative appointment with your surgeon, you will need to have an assessment performed by the staff at the Floyd Pre-Op Evaluation Center, located in the 330 Physician Center on the Floyd Medical Center campus. It's possible that your pre-op assessment can be completed over the phone, but in many cases, a visit to the Floyd Pre-Op Evaluation Center is needed. A member of our nursing staff will contact you to determine if this in-person appointment is required. Your visit to the pre-op center will include registration, a thorough review of your medical records, a history and physical exam, counseling about medications, and possibly an EKG and blood draw. Your assessment through the pre-op center is designed to prepare you for an efficient surgical process and to ensure your overall health is optimized for surgery. You will be given counseling regarding medications and diet prior to surgery, as well as a written patient guide that will outline the surgical and recovery process. To ensure this process is as thorough as possible, please bring all home medications for our staff to review. This should include medications given by injection. If you carry a wallet card indicating you've had a pacemaker, defibrillator, or heart stents, please bring that also so we can have a copy on file. Now, there are a few subtle differences in preparation for surgery at the hospital compared to surgery at the physician center. This is why we encourage you so strongly to read the information you've been given and ask any questions that may arise. For now, we'll focus on those steps that are common to both. As you plan your arrival, keep in mind that you should wear loose, comfortable clothing and no jewelry. When you arrive, Floyd will have a shuttle available that can pick you up from the parking lot and drop you off at the front door. We also feature a drive-under portico for those patients who are being driven to surgery appointments. This allows you to be dropped off at the front doors of the main entrance. Parking at the main entrance will provide easy access to patient registration, the main elevators, cafeteria, vending, and the 330 Physician Center where the outpatient surgery center is located. The 330 Physician Center also features a drive-up lane for patients who are being driven to their appointments by another person for surgery at the outpatient surgery center. Visitors to Floyd who prefer covered parking may park in the hospital's parking deck located across Turner McCall Boulevard from Floyd. Patients parking here will enter the north entrance via an enclosed overhead walkway. The next step, once you're inside, will be to register, even if you've completed the pre-admission process. There is a check-in desk at both locations. Depending on where your surgery will take place, one of these will be your first stop. Once you've arrived and notified the registration desk, a member of the Floyd team will walk with you every step of the way. When it's time for your surgical care team to prepare you for surgery, you will be taken to the pre-operative holding area. During this time, a family member may accompany you and may stay with you until time for your surgery, though it's important to note that the pre-op area is comfortable for no more than 1 or 2 family members or friends. Once you're in the pre-op holding area, a nurse will complete a health assessment with you while all lab work and permits are reviewed. An IV will be inserted, which will be used during surgery to provide you with medication and to replace fluids. For young children, an oral medication may be given in lieu of an IV. If an IV is required for small children, it will typically be inserted after anesthesia, though this isn't the case in every circumstance. For your peace of mind, a member of the anesthesia team will visit with you and discuss the procedure, answer any questions, and address your concerns. At this time, nerve blocks will be performed if recommended by your surgeon or anesthesiologist. Your surgeon will also visit during this time to touch base and to answer any final questions you might have prior to surgery. Our staff will make every effort to provide frequent communication with you as you await surgery. Emergency delays are always a possibility, but you can be confident that our surgical team is working hard to minimize your wait and put you on the road to recovery as quickly and efficiently as possible. In an effort to prevent the spread of germs or infection, hand hygiene is a top priority. You are always within your rights to ask if your caregiver has washed and sanitized their hands. A member of our surgical staff may have the need to communicate with a member of your family during surgery, so it's important that you have someone who will remain in the waiting area during the procedure. There are patient locator boards in the waiting area of both locations, so your friends and family can stay informed by using a patient locator number assigned to you upon registration. A designated family member will be given a pager so they are more easily reached for progress reports. We understand that the anxiety surrounding surgery affects not just you as a patient, but your family also. That's why we have a variety of amenities available to you and your family as our invited guests. These include comfortable visitor waiting rooms with easily accessible nurses' stations, a wide range of dining options, vending and snacks, pastoral care, and translation services. The 330 Physician Center also provides a play area for children who are waiting along with family members. After your surgery, you will be moved to the recovery area. There, a nurse will check your vital signs and dressings often and will be available to treat any pain or nausea you might experience. A family member or friend should be able to rejoin you at this time. Once you're awake, your blood pressure is stable, your temperature is within normal limits, and your pain is under control, you will either be transferred to your room or released to return home. If you are staying in the hospital, your nurse will meet you and perform an admission assessment, which will include a check of your vital signs, a check of your dressing, and an overall evaluation to determine the status of your recovery. This assessment will also include questions about your medical history and the location, type, and severity of your pain. If ordered by your physician, your nurse will also administer your home medications. If you have an epidural or a patient-controlled pump for pain, this will be discontinued as soon as possible and your physician will order other pain medications. Our goal is to make you as comfortable as possible. Your pain will be reduced, but probably not totally relieved. Be sure to let your nurse know if the pain medicine is not working or you don't like the way it makes you feel. Depending on your procedure, you may be visited by social services staff. They will spend some time with you and your family to assist with arranging home health as well as outpatient physical therapy if needed, and will help arrange for any equipment you will need after discharge. A physical therapist may also visit you, again, depending on your procedure. The therapist will assist you with exercises, transfers between your bed and a chair, and with walking. Your surgeon will also visit at some point during the day. The time of this assessment will vary as some physicians make rounds in the morning, while others visit later in the day. We believe that family and friends can brighten your day and be therapeutic to your recovery. Visitors are encouraged to check in during designated visiting hours, which vary based on your condition and location. Information regarding visiting hours is posted in the hospital and is also available on our website, floyd.org, or by calling the information desk. When you're cleared for discharge, your nurse will give you instructions to follow after your dismissal. These will include information about medications, diet, follow-up appointments, and home care services. This information will be important for your recovery. If your surgery required an extended hospital stay, our staff will work to have you ready for release by 11 a.m. on the day of your dismissal. You should arrange for your transportation from the hospital to arrive by 10 a.m. At discharge, patients typically return home. If you live alone, it's important to have additional help following surgery for as long as is recommended by your physician. Home care services can be provided that will include physical and occupational therapy if needed. Once home, call your physician immediately if you have questions, notice pain or swelling around the incision, develop a temperature over 101, or have a sudden onset of shortness of breath. Finally, please make note of these reminders. Follow the activity guidelines you and your doctor discussed. Use your pain medications as prescribed. Follow your wound care instructions. Watch for signs of infection or swelling, and attend your follow-up appointments with your physician. Thank you for choosing Floyd Medical Center for your surgery. We wish you a speedy recovery. Please let us know how we can make this experience the best it can possibly be for you and your family.